ma'am, we are from Medgate today and we have a few questions for you. Ma'am, what are the most promising advancement in stroke prevention for high-risk populations?
From the prevention point of view, if you talk about, that after a stroke, the chances of a person developing a next stroke is about 10 to 15% in the next 1 year. If you look at the advances, we have to look into the etiology of the stroke. Most important is prevention of the risk factors, looking into very good control of the risk factors. Next is adherence to medication, wherein people are developing apps which the patients can use so that they get reminders for taking the medication, control of the risk factors. Third is we have got a lot of newer drugs available for cardioembolic strokes, wherein newer anticoagulant medications are available which can be used by the patients and the family because they have got less need of monitoring and less risk of bleeding, which can be used more effectively. Another most important aspect is with regard to some devices have come. For example, in patients with atrial fibrillation, when they cannot take anticoagulation, they have got LA devices which are available, whereby it is a preventive strategy wherein these patients can also prevent it from having a second stroke.
And ma'am, how can public health campaigns be more effective in raising stroke awareness?
I think public health campaigns happens at all levels. I think it should be starting from the public, wherein you need to have TVs through which small short bites of what is stroke or the symptoms of stroke. That is one thing. Second is we should have awareness through the physicians because they are the people who are the first contact for treatment, and through the EMS personnel to recognize the stroke. So it should be at different levels, and most important, get celebrities to talk about stroke because everything is social media now, so that they speak about it and they have got a lot of followers in them, so that is the best way to do it. And school education, I think educating the children in school, which we were talking about in the session, I think educating the children go and tell their parents, and that is another way of doing it.
And one more last question, ma'am. How can research on stroke better incorporate diverse population to ensure treatment outcome?
I think currently, if you look at India, we are also looking at all kinds of populations being included in the stroke. Previously, there was a lot of restrictions regarding what are the population we should be including, it's male versus female, rural versus urban. So I think currently the thing is different. Everybody are aware of that. The stroke research, and there is no limitation regarding can I join a research project. So I think currently if you look at the Western data and also the Indian data, it is more inclusive in taking the patients into the study. So, and most of the studies are more global and multicentric, so that we have all kinds of population included as Asian versus non-Asian, black versus white. So all these patients are included, so that the information which comes out of it is a positive study or a negative study, the information comes out will be globally applicable to all patients.
Thank you so much.